Welcome to the MS Education podcast series. Thank you for joining me. I'm Andrea Salmon, and in each episode, we are going to be joined by an expert to discuss strategies for living well with multiple sclerosis. Today, we're talking about working when you have multiple sclerosis. And my guest today is Natalie Holland. Natalie is an MS Employment Support Consultant with the MS Employment Support Service. And Natalie has worked as an occupational therapist for 22 years across Australia and the UK. And she's been working with the MS Employment Support Service for the past 2.5 years. Welcome, Nat. It's great to have you here.
Hi, Andrea. Thank you for having me.
Nat, do you find that a lot of people stop working when they receive a diagnosis of multiple sclerosis?
No, I actually wouldn't say that many people do stop work entirely, but I would say that almost everyone has questions that come up and worries about their work. Things like, am I going to be able to manage my job now? Am I going to need to tell my boss? Will people at work be able to tell that I have MS? Will this mean that I need to stop work earlier than I had wanted to do? And if I do have to stop work, how am I going to support myself? So these are some of the really common and very real concerns that come up for people. And it helps to then be able to have a person or persons around you who can give you good advice, and it can help you navigate through the uncharted waters.
Absolutely. I couldn't agree more. And I'm sure everyone knows that if they don't have a support network already, MS Connect's a great starting point.
Yes.
Nat, can you outline how multiple sclerosis might impact a person's ability to work? And can anything be done about it?
Well, as a rule of thumb, if symptoms have any impact on you at all in your daily life, then they will also inevitably have some impact on you at work. But the degree of that impact depends on the particular symptoms that you've got, as well as the job that you do, and also some other external factors. And we know that symptoms of MS vary really widely between individuals, but I can give you some concrete examples of clients that I've seen and some of the issues that they faced. So, for example, someone who was doing an office job and found that the fluorescent lighting and the glare from computer monitors was causing a lot of headaches, and she was needing a lot of time off work. It was really impacting her ability to be able to look at the computer screen and be in that office all day. Someone who worked as a pickpacker, and she was having some weakness in one of her arms, and it was making it difficult for her to be able to lift packages overhead. Someone who was working as a gardener and was quite sensitive to the heat. He was finding it challenging to be able to work outdoors, especially in the summer months, and had to manage that. Or someone who has a long commute to work, and this lady was experiencing bladder changes and was finding it difficult just to get to work on time because she had to stop a number of times. So, these are real people with real symptoms. And it's interesting to add too that, that's 4 different people. And out of those 4, 3 of those are working full time. Like, it sounds like they're experiencing a lot of challenge, but they're also overcoming the challenges in different ways. And certainly another really common symptom that a lot of people, almost all people with MS experience is fatigue. And that really manifests in a multitude of different ways. But you can imagine someone, for example, in an office job who finds that they're losing concentration by mid-afternoon, and they start to become less productive, and they might be starting to make more errors in their work. So we can look at how we address that. And really, I think the biggest step is the first step, which is just identifying what those symptoms are and acknowledging that they do have some impact on your work, as opposed to just pushing through or just pretending that everything is okay. So in that, that last example of fatigue, there would be a number of different ways that we could approach that. For example, we could look at maybe changing work hours to start and finish earlier if you're better earlier in the day, or you could start and finish later if you're better later in the day. We could look at, how you're taking your rest breaks. Do we spread them out so that you have more regular rests, or do we condense them all up and have a bigger rest in the middle of the day, for example? Or can we even negotiate so that you can work one or more of your days from home, so that you can help with, eliminating the commute and helping with fatigue that way. So
Great
there
ideas.
really
Yeah.
is, yeah, there's heaps of different strategies. And look, these are just some of the strategies, and some of the other things that we bring in is also, equipment modifications, entitlements
Mm,
that can help. And hopefully I might get to chat to you a little bit more about that later on.
cool, for sure. So, do you
Mm.
have to tell your employer that you've been diagnosed with MS?
Yeah, this is a really common concern, and I'm glad that you've asked. But the answer in most cases is no. So,
Mm,
legally, you don't have to disclose your multiple sclerosis to your employer unless your symptoms affect your capacity to perform the inherent requirements of your role, or if they
mhm,
present an occupational health and safety risk to yourself or other people. So,
mhm.
for example, if you're a truck driver and you're experiencing blurred vision, that's potentially a safety issue, and you would need to tell
Yeah.
your employer about that.
Yeah.
But otherwise, in most cases, as long as you're still able to perform the core duties of your role, there's no safety issues, then it's up to you really whether you choose to tell your employer that you have MS or about any of your symptoms. So this is a discussion that we can have with you, if
Mhm.
if we're working with someone, because there are positives and negatives about telling an employer, but
Yeah.
you can take control over it and you can choose who you want to tell. You don't need to tell everybody. You could just tell your manager, or you could just tell one colleague who you'd like to have support from.
Mhm.
Um, you can choose how much you tell them. You don't need to tell them everything. You can just choose to tell them the things that are affecting that particular uh, job that you're doing, and you can choose the timing of when you choose to tell. So
Mm,
you can really have control over that process.
that's great. Yeah.
Yeah.
What would be your recommendations to someone recently diagnosed with MS?
Don't panic. Really, don't
Yeah.
panic. In terms of employment, people with MS do continue to work in roles that they enjoy, as well as juggle the other commitments that they have in life, like family and community life, just as
Yeah.
much as their colleagues without MS do.
Mhm.
In most situations, there are ways to overcome the symptoms that you have at work so that you can continue doing a great job.
Mm,
So I would say don't make any rash decisions. Don't just throw in the towel, resign from your job, make any
mm,
big
mm.
changes without getting some advice first.
Yeah.
It's a
Yep.
really great idea to get in touch with MS Connect. I know you mentioned before.
Mhm.
They can tap into a huge range of services that are available, anything from nurse advisors to peer
Mhm.
support groups, where you can link in with people in similar situations to yourself, through to, employment support service like where I work.
Yep. Yep. Absolutely. I think there's lots of great advice out there. Can you
Yeah.
tell me more about what you mean about not making any changes?
Well, in most cases, we can work with you and with your employer to make your job work for you. Or maybe
Mhm.
we can explore other opportunities that are present within your company so that you can retain the relationship that you've got with your employer, but maybe just make a sideways move to something that's more suitable or appropriate for you. So it's important not to have a knee jerk reaction. Where you might then burn bridges, or you might need to
Mm.
spend some time out of work that you didn't want to have. If it does turn out that your role is no longer manageable for you or desirable for you, then we would want you to take control of that process and
Mm.
exit in a way that works for you. So,
Yep.
possibly once you've had a chance to do some retraining or to put out some feelers for other jobs or even secure another job. Um, and you can then take control of that exit process.
Yeah, that's great.
Mm.
And I know there's lots of legal ramifications and entitlement ramifications. So, yeah, that's great advice. Don't make any
Yeah.
changes until you get advice.
Yes.
Now, Nat, you work for the MS Employment Support Service. Can you explain a bit more about that program?
Yeah. So the Employment Support Service is currently based in most of the main capital cities and metropolitan centres around Australia.
Hmm.
Um, we help people who would like to enter or re-enter the workforce who've got MS, as well
Hmm.
as probably the main group of people that we work with are people who are already working. They have MS and they just need some guidance or help with symptoms or how to manage it, certain issues within their work. So we work with people in all industry sectors and levels. It doesn't matter if you're a CEO of a corporation, or you're a flight attendant, or you're a landscape
Mm.
gardener, or a factory worker, or you could even run your own business from home. It also
Mhm.
doesn't matter if you're permanent or you're casual in your job. Doesn't matter if you have multiple jobs. As long as you're working 8 hours or more per week, we can assist you.
Mm.
So we look at work in a really holistic way from a number of different angles. And I talked a bit earlier about symptom management and how
Yeah.
you can look identifying your symptoms and looking at strategies to help overcome those. But we also would look at things like lifestyle factors. So
Mhm.
we recognize that there is a huge overlap between home and work life. For example, if you're spending all day Sunday cleaning your house and then this totally exhausts you, then you're going to potentially carry that fatigue over into Monday at work. And
Mm.
then that Monday might be a struggle for you. So, how could we do that differently? Or how could that be maybe outsourced? So we could look at things like that, and we look
Mm.
at diet and exercise and MS medication and other health and lifestyle factors. In many cases, these are factors that you might have some control over.
Yeah.
So, being able to control those factors more might then help with your symptoms, which then might help with your work and other parts of your life as well.
Absolutely.
So,
Yeah.
yeah, it's all connected. Um,
Yes.
we can certainly look at the workplace environment, the
Uh-huh.
physical environment where you work. We can go in and do an ergonomic assessment or a workplace assessment to look at any issues that there are, or potential improvements that we could make to you to help you keep doing your job well. There's a government funded scheme out there called Job Access, which
Mhm.
helps to be able to purchase equipment or modifications that are going to help you manage your symptoms at work, which could be anything from ergonomic chairs with better back support, or height adjustable desks, or
Mhm.
cooling garments or heating garments, or
Wow.
really the world is your oyster as long as
Yeah.
it can help you at work. So that's something
Fantastic.
that we can utilize. Yeah. Another thing that we can do is to get involved with talking to your employer. So we
Mhm.
can act as an advocate for you, assist in the process of disclosure if that's something that you're wanting to do. We can
Yeah.
provide education about MS to your employer or to your colleagues if you would like us to do that. We can help to negotiate flexible working conditions, possibly like modified hours or like working from home.
Mm.
So
That's great.
it's really varied, and it's worth also mentioning though that these talking to your employer or going into your workplace, obviously those things are dependent on you having disclosed at work. I
Yeah.
wouldn't want people to think that we're gonna if you were to get our service involved, we would automatically be going in and telling your employer about things, or
Mm.
doing a workplace assessment. We certainly don't want to compromise your position or jeopardize things in any way. Um,
Yeah.
you know, the service is voluntary, your participation is voluntary, and we just want to work with you at wherever you're at and what's going to work for you. So we'd be
That's
guided by you
wonderful.
100%.
Yeah.
Yeah.
That's great.
Hmm.
And Nat, you mentioned that the ESS service is in the major cities. What can people do if they're in
Mm.
regional areas?
Yeah, it's correct. So we have staff in the metropolitan centres, and I think it was set up that way, so with a view that we could provide a face-to-face service in those
Uh-huh.
within sort of a 1 hour distance of the offices in the major cities. Um, Having said that, in COVID times as we are now, we've all been working from home like a lot of people, and
Yeah.
delivering our service via telehealth and remotely. So potentially that might open up opportunities in the future to for us to, maybe broaden our horizons and get more outreach into the regional areas. I'd certainly love to see that happen. Um, but at the end of the day, at the moment, that's still our base. But if
Uh-huh.
you were listening to this and in need of support and you're living somewhere regional, remote in Australia, I would still encourage you to get in touch with MS Connect, because they can
Yeah.
put you in touch with one of us, and we can get in touch with you over the phone, and talk through a situation that you've got in the workplace or some questions that you might have. Certainly, very
That's
happy to do that.
great. That's great. That's great. We've
Mm,
mentioned a couple of times entitlements. It,
yeah.
why is it so important to understand our entitlements?
Entitlements are actually really helpful to anyone with MS. They are provisions that are put in place by the government to help people out. But the problem is that they tend to not advertise them or market them at all. So people are generally unaware that they even exist, let alone how they can access them. People might know about things like the mobility parking scheme, which allows people to be able to park in disabled spots or in timed spots for extended periods of time. Um,
Okay.
there's also the taxi transport subsidy scheme people might know of as half price taxis.
Yeah.
Um, yes, it subsidises the cost of taxis. Um, so if you look at those two schemes alone, like that sort of starts to provide some options for commutes, perhaps, so that you might not need to take public transport. Perhaps it's an option for you to drive and to be able to park close to work,
Yeah.
um,
Yeah.
or take a taxi sometimes if that is feasible. Um, there's a healthcare card that provides a significant discount on your prescription medication, so it helps
Yeah.
financially. Um, and there's the National Disability Insurance Scheme, the NDIS, which a lot of people have heard of and quite a lot of people have accessed as well. But it provides funding for a wide range of supports like domestic help, allied health services like physio and occupational therapy, exercise physiology equipment, and a lot of other things as well. So
Uh-huh.
um, looking at some of these entitlements, you can use these to
Mm.
help with fatigue management or to help with health management through accessing allied health. You know, more often to help with symptom management. So we kind of look at the whole gamut of these entitlements, and there are more as well,
And they're not
to look at
means
how they can
tested,
help.
Nat?
No, I don't think any of those are.
So people can
Yeah.
be accessing NDIS and employment support?
Absolutely, absolutely. Yeah.
Yeah.
Employment support is not part of NDIS.
Mm.
We are actually funded by a government stream through Disability Employment Services. But it's worth mentioning, I didn't mention before, it's a free service. It's
Mm.
free, it's voluntary. Yeah. But some of the other entitlements I was going to mention as well,
Mm.
that's important just to know about is some of the insurances that you can have through your superannuation policy or privately. They can be things like income protection or TPD, which is total permanent disability protection. And these can just provide support if you do need to reduce your hours or if you need to step away from work. So it's important to know that they're there in case you do
Yeah.
need those. Yeah.
Absolutely, absolutely, and I think you're right. There are a whole lot of entitlements that we're just not aware of until we
Mhm.
might need them. But
Yep.
how do we find out? That's great.
Yeah.
Yeah. So, is your workplace actually required to make changes for you if you find that you're having difficulty with things like temperature or lighting glare? What about those kind of open plan workplaces where you have to walk halfway across the building to get to the printer?
Yeah. Okay. So employers do have an obligation by law to provide reasonable accommodations for people with disability, and that
Mhm.
can possibly be open to interpretation. But
Okay.
we
Okay.
find that most employers are very open to discussion and happy to help where they can. It
Okay.
usually does help if they can be reassured of how these changes will help their business because it will allow their staff to be at their most productive. So that's
Yeah.
something that usually appeals to bosses. Um, but we could do, say, a workplace assessment and we could look at the barriers that are affecting your productivity and make some recommendations around how these could be improved. So, in that example that you were saying about having a long way to walk to the printer, it could
Yeah.
be as easy as switching desks or relocating a desk so that you can be located closer to the printer or closer to the bathrooms or whatever it is that you
Uh-huh.
need to be close to. Or if there's equipment that will help, we can look at accessing that government fund, job access. We can get things like noise cancelling headphones or a height adjustable desk or
Yeah.
lightweight boots or heating gloves or whatever it is. And usually employers are very happy that equipment or modifications can be obtained at no cost to them and no cost to the
Mhm.
employee either. So it's kind of a win-win. Helps their employees do their job, and everyone gets on with things.
Absolutely. That's
Yeah.
awesome. So, in summary, you're suggesting that people shouldn't make changes before getting advice. And you've also really outlined that there's a lot of support available to help ensure that people can keep working, even if they've been diagnosed with multiple sclerosis. Have I got that right?
Absolutely, yes. Yeah. Look, the skills and experience that you have, they don't evaporate when you've been diagnosed with MS. So you're just as valuable to your employer now as you were before, and life goes on. So, but sometimes it does help to just have a look at the symptoms that you've got and how they might be affecting your work. So then strategies or adjustments can be found to help with that. There is a lot of support available. We talked about entitlements. There's the job access scheme. We can look at strategies, modifications, and there's a lot of supports that you can access through MS Connect. Certainly a consultant from the Employment Support Service where I work would be happy to have a chat to you about your individual situation. We can provide some advice and help you to take the next steps.
Look, it's just been fantastic talking to you, Natalie. I have the feeling that we might be having to invite you back for another topic related to work. So thank you so much for the chat, and I'll look forward to talking to you another time.
My pleasure, Angie.
For more information on anything that we have covered today, please get in touch with MS Connect on free call 1800 042 138 or email msconnect@ms.org.au. And don't forget to find the MS podcasts on your favourite podcast player such as Apple, Google Play, Spotify, Overcast, or you can access the podcast directly from our website ms.org.au.